Hi there, I have got some awesome new product to share with you. This is a product that is going to be great for our pregnant patients. It's called Mother Nurture, and what it is, it's a three-step process to orthotics to help correct and alleviate pain while you're pregnant. So it starts in the second trimester. Here is a little example of what it looks like, and it has Velcro on the back. These stick in your shoes. There's like a little dot you can put and it prevents it from like slipping. So we've got the second trimester one. So in the second trimester, this is when you sometimes even find out you're pregnant, and you have the most ligament laxity in your body. So what does that mean? That means if your arches in your feet get like lax, they kind of stretch out. Some women even notice that their shoes don't fit correctly anymore, or that they gain another shoe size. So this is between weeks 28 and 30, or excuse me, that's not second trimester. It's between 13 and 27. And then one statistic I found was that with low back pain, it affects 68.6% of women during pregnancy. So what orthotics can do not only help with like foot, knee, hip pain, ankle pain, but low back. So these, what we call like stabilize the pelvis. So as you know, when you're pregnant, or if you're pregnant now and you don't know, the pelvis shifts, the tailbone shifts, and what we need to do is stabilize it. So this supports you like from the ground up. So you're thinking like a house. If you support your foundation, everything above it is going to stand correctly and it won't like lean to one side. So these support three arches to the foot. A lot of things over the counter, like a Dr. Scholl's, only supports one. It's the medial arch, but you have like a lateral arch and a transverse arch that also needs to be supported, because sometimes the medial arch isn't the bad one, it's the other two arches. So when you just get a Dr. Scholl type one over the counter, it in fact isn't helping at all because it's not your problem. So what we do at the office is we do a scan. It's a customized scan. It scans your feet. There's no radiation or anything. And then this company called Foot Levelers, they create these products called Mother Nurture. And it's custom to your scan. It takes like 1,000 points of the foot and it recreates a model and a mold for this company to make them custom. So we've got second trimester, and all of these come in this little box with a little kit of everything. So after the second trimester, now we're moving to the third. That's when I meant we have the 28 to 30 week. Okay, so these are the third trimester one. And this is when the baby has like the most weight. You're gaining what, 25, 35, I don't know, heck, maybe even 50 pounds. And all that extra weight is still causing you that back pain. So imagine if you had back pain even before pregnancy. Now you've got weight and distribution that's shifting and changing your pelvis alignment. Yet another reason you need to be stable from the bottom up. So if you had a first pregnancy and you had a lot of sciatica or hip or tailbone or back pain, guarantee the second one's going to have some issues too. And that's when you need some support under your feet. So after that, we move into the postpartum. And then this is when things are going to start to change and shift. Even though you'll be dropping the weight, your body still has a lot of the relaxin hormones, still making everything loose and unsteady. So your adjustments aren't even going to hold as well. These will support you the whole time. So this is like 3 to 5 months after, maybe even longer. And in fact, I read a study, the longer that you nurse and breastfeed, the longer the relaxin hormone stays in your body. So for some of us that maybe have nursed for a year, that whole time that relaxin hormone is in your body. And what does the relaxing hormone do? It's relaxing the ligaments in your body, including your feet, your knees, your hips, your low back. So that's why we still have a lot of what I call like loosey-goosey. Things are still not staying in place. So it also comes with this little foot roller. If you've ever had foot pain before, you know how great these are to roll your feet over. So imagine being pregnant and feet swollen and sore because of the extra weight. This is awesome. So there's this whole packet. It's called Mother Nurture. We do a free scan in your feet. This company creates all three of these. You get them all in a box, so you don't need to come back every time. We've got trimester 2, 3, and the postpartum, and it comes with this little foot roller. So it's really neat. I'm excited that they finally did something like this for women. They've also always been great at different orthotics for women, especially for like dress shoes. But now that they offer this for our pregnant women, like this is when we need all the support the most. So contact me if you have any questions. I'm pretty excited about that. You can come and feel them. They're super soft. So a lot of old school orthotics are like hard, rigid plastic. These are like super soft and squishy. So if you want to come and feel them at the office, that would be awesome too. So thanks for watching.